It starts suddenly. One wrong move, one misstep, and a sharp pain shoots through your knee. You look down and something doesn't feel right. Your kneecap isn't where it should be. For many, that moment of panic is unforgettable. Today, we're diving deep into what really happens during a kneecap dislocation, why it happens, and how medical experts safely put it back in place. This is not just another injury story. It's a breakdown of how your body reacts in crisis and how quick action can make all the difference. Imagine you're playing a friendly football match. You twist to change direction, and suddenly, pop! Your kneecap slides out to the side. The pain is intense, your leg locks, and you can't move it. Sounds dramatic? It is. A kneecap dislocation, or patellar dislocation, can look terrifying, but understanding it might just save you from long-term damage or even chronic instability. The kneecap, or patella, is a small triangular bone that sits in front of your knee joint. It glides up and down a groove on your thigh bone every time you bend or straighten your leg. Its job? To protect your knee and improve leverage for your thigh muscles. But when the knee is twisted forcefully or receives a direct blow, that small bone can slip out of its track, usually to the outer side. That's when the chaos begins. You'll often feel or even hear a popping sound. The knee may instantly swell, and it becomes nearly impossible to straighten or walk. The kneecap might visibly sit off to the side, giving the knee a deformed look. The surrounding ligaments, especially the medial patellofemoral ligament, are stretched or torn, which is what makes the injury so painful. But what actually causes this to happen? In many cases, sports that involve sudden direction changes, like basketball, football, or dancing, are the main culprits. However, not all dislocations come from trauma. Some people are born with shallow grooves or flexible joints that make them more prone to dislocation. Weak thigh muscles, previous knee injuries, or even wearing high heels too often can increase your risk. Now, when a kneecap dislocation happens, the first instinct is often panic, but this is where knowing the right technique and steps can prevent further harm. The golden rule: never force the kneecap back in place on your own unless you're trained or there's no medical help available. In medical settings, professionals perform a careful reduction technique. The patient lies flat, the leg is gently extended, and pressure is applied on the side of the kneecap to guide it back into its groove. When it clicks back in, the relief is almost immediate. Once the kneecap is reduced, the journey doesn't end there. Doctors usually recommend an X-ray or MRI to rule out fractures or cartilage damage. The knee is then immobilized for a few weeks, followed by physiotherapy to strengthen the quadriceps and stabilize the kneecap. Exercises focusing on the inner thigh muscle, the vastus medialis oblique, are crucial for preventing future dislocations. Recovery time can vary, from 4 to 6 weeks for a first dislocation to months if surgery is needed. And here's something most people don't realize. One dislocation can increase your chances of it happening again. That's why proper rehab and muscle conditioning are absolutely essential. A dislocated kneecap might sound like a freak accident, but it's more common than you think, and it's treatable. The key lies in understanding your body, reacting calmly, and getting professional care immediately. So the next time you hear that pop or see someone clutching their knee in pain, you'll know exactly what might be happening. Stay aware, stay careful, and keep your knees strong, because they carry you through every step of life.